A student is critically injured after being run over by a car.
Abdo is quite firm, both lower legs broken.
3.
A man is found unconscious after a seizure.
How was he prior to the fit? Was he all right?
He had his eyes open, but he's completely unresponsive.
And the air ambulance is called to a man having a heart attack.
OK, we've just given you some morphine. On a scale of 1 to 10, how bad is your pain at the moment? 7.
The critical care teams provide advanced life-saving skills and equipment across the West Midlands. In a typical 12-hour shift, they'll respond to around 17 life-threatening emergencies. Tonight, Dr. Katie White and critical care paramedic Richard Apps are on call when Control takes its 3,730th call of the day so far.
Hello, ambulance service. Is the patient breathing?
Yeah.
Is the patient conscious?
Yeah, he's making noise. We've crashed into him.
You've crashed into him?
Yeah. He was just standing on the road.
And you've driven into him?
Yeah.
OK. Is he responding to you? Is he awake?
Kind of. Not now. He was before.
But he's not now?
Yeah.
OK. The ambulance is coming. We're coming as quickly as we can.
Hello, Katie. Update for you. The patient has been hit by a car, fractured lower limbs, and the head injury.
An ambulance crew is already on site and treating the patient. But his injuries are so severe, they're concerned he may not make it to hospital alive. So the critical care team have been called.
Crew request for our attendants. Reported head injury and lower limb fractures. We just have to do our trauma assessment when we get there and work out what interventions are required. Are you on the truck? Are you on the truck?
Yeah, they're about to go. So
oh, right. Yeah, we'll hop on.
We'll have a quick look.
Yeah.
By the time Dr. Katie and Richard arrive, the patient has been moved into the ambulance.
It's got GCF on about 8.
OK.
We've managed to get him on the spinal board. It's got pelvic binder, it's got TXA going as we speak.
The ambulance crew brief Dr. Katie and Richard.
Aged 20s, hit by a car, quite some speed. He's got a body mass on the right-hand side,
yes.
back of his head.
See, OK.
Chest sounds clear.
22-year-old student Jatin was filming his friend driving a car on his mobile phone when he was run over.
Abdo is quite firm, both lower legs broken.
OK.
As well as breaking bones in both his lower legs, the impact has also broken Jatin's right femur, the longest and strongest bone in the body.
He's maintaining his own airway. We've got symmetrical chest expansion.
TXA just going through.
TXA, brilliant.
He could also be suffering from life-threatening internal bleeding. So a drug used to help blood clot called TXA or tranexamic acid is given intravenously.
We're here to look after you, OK? You're doing really, really well.
Keep your arm, keep this arm still.
Nice.
That's it, there we go.
Absolutely great, OK?
As Jatin is extremely agitated, a police officer helps to restrain him so he can be treated.
Just keep nice and still for me. You're doing absolutely great. All right, good man. Can you squeeze my fingers for me?
Jatin is not responding to Dr. Katie, a sign that he could have suffered a traumatic brain injury.
Yeah, OK? Squeeze my fingers for me.
And we'll right turn out. Happy? Okay, yeah. Okay, and the lifting.
The Midlands Air Ambulance charity was first established in 1991 to provide rapid life-saving care to patients who are often in remote locations.
Okay, coming up and right.
Since then, they've flown over 66,000 missions. When every second counts, The helicopter can reach most parts of the region within 10 minutes.
03, we are 404 minutes.
Ambulance service. Is the patient breathing?
Yes.
What's happened?
He's got central chest pain. He's a man working on our roof.
Am I able to speak to him directly, taking through an assessment? Hello. When did this pain first start? About 20 minutes ago. Would you describe it as a crushing or severe aching pain in your chest? Like an aching pain, yeah. Is the problem so bad it's stopping you from doing all of your usual day-to-day activities? Yeah. Okay, so I'll come in on blue lights and sirens, so we're going to be there as soon as possible.
An ambulance is immediately dispatched. An urgent assistance is also needed from the air ambulance. On board is Dr. Jake Turner and critical care paramedic Mike Andrews.
Yeah, that's received, thank you. So it's a 51-year-old gentleman. He's got a 2-day history of central chest pains, all obviously normal parameters.
There's a male patient who's having myocardial infarction, so heart attack, and they want us to convey him to Stoke.
A myocardial infarction or heart attack is a serious medical emergency in which the supply of blood to the heart is suddenly blocked. The patient needs treatment in a specialist centre fast.
03, can I just confirm is this a private residential address, over?
It's a residential address to the south of Shrewsbury.
03, it's all received, thank you.
It's on that right-hand slope of one of these hills, isn't it?
He is in the middle of nowhere, bless him. Here we go, down on your 2 o'clock. Yeah, like coming into your 3 o'clock.
Yeah, looks like they're re-roofing the house.
19 minutes after the 999 call came through, the air ambulance lands in a field 10 miles south of Shrewsbury.
And we'll call landing.
There's a gate there. So you can drive the ambo just around there, hopefully, so we can be really close.
The ambulance crew are treating the patient in the back of the ambulance. He's connected to an electrocardiogram to monitor the activity in his heart.
Started today, did it?
Today.
Yep.
Approximately 1 o'clock.
Yep.
When we got to him, pain score of 8 out of 10. After aspirin, GTN and 5 milligrams of morphine, we got it down to about a 5, but it has just started getting a bit closer now.
Cool.
No medical history, no medications, normally fitting well,
okay.
No allergies.
51-year-old builder Steve was carrying out repairs on a friend's roof when he began to experience severe chest pains.
We're going to fly to Stoke Hospital. They're going to take you to the cath lab, look at your heart, get the blockage out and sort you out. Cool, you've got a nice strong radial pulse.
Unlike a cardiac arrest where the heart stops beating completely, with a heart attack, the heart is still pumping blood, but could eventually stop if urgent medical treatment is not provided.
Do you feel sick at all?
I've been sick.
You've been sick?
I feel sick now.
Has he had any antiemetic at all? Or?
Yes, I don't.
Cool.
Before attempting to move Steve to the helicopter, Dr. Jake needs to get his pain under control.
OK, we've just given you some morphine. Okay, on a scale of 1 to 10, how bad is your pain at the moment? 7. All right, well, if that morphine doesn't work in the next few moments, we're going to give you some more when we get you to the helicopter, OK?
Thank you very much, thank you.
Yeah, you're more than welcome, mate. And the pain started today?
Feeling a bit strange.
Oh, sorry, I could help you there, couldn't I? That would have been very helpful.
Saturday, like,
yeah.
Just like pins and needles and a bit.
But the severe pain is just... The severe pain's just been today, is it?
Yeah, either severe, do you know what I mean? Nothing like that.
Steve has chest pains, a tingling sensation in his arms, and he's been sick. All classic signs of a heart attack.
Unless you're putting it on.
You're unless all this is for no reason, you know what I mean?
Give me the scale to 1 to 10. What was the scale of my heart attack on 1 to 10?
You're having what looks to be quite obvious.
03, thank you. Just a bit of an update. So just in the process of moving the patient to the heli. We'll talk to you when we've lifted en route to Stoke.
The blockage in Steve's artery is damaging his heart. How much harm it's inflicting depends on how big the artery is and how long it takes to get him to hospital.
I'll come back to you with an ETA to Stoke, mate.
ambulance service. Is the patient breathing?
My partner, he's having a stroke or something. Please hurry.
Okay, is he breathing?
Yes, but he's slavering. He's got blood coming out of his mouth.
Is he struggling to breathe?
Yes.
Has he had a fit or a seizure?
I don't know. It might be. I'm so frightened.
Right. In fact, you may as well go to the 838 and down.
Ready to respond to the most serious medical emergencies is critical care paramedic Tom Waters and paramedic Ben Reen.
So we're on our way to a 76-year-old male. There's a crew on scene already who have requested red backup, so they've got a second crew going, and we're going to go and support them for that as well.
The ambulance crew and attendants provide an update on the patient's condition.
This 76-year-old is unconscious, noisy breathing, so there's maybe a bit of an airway occlusion. And just reading in the notes as well, it says that he's got a history of a brain tumour, he's bringing up blood and he's unresponsive.
13 minutes after they received the call, Tom and Ben arrive at the address.
Hello. Hello.
This is Lionel, just had a seizure.
Right, with you, witness.
Literally just witnessed, so we've just given 10 of my dad's.
When the ambulance crew arrived, Lionel was having a seizure. They gave him a drug to stop the fit, but he's still barely conscious.
We should get him on the floor.
Yeah.
Face him around this way.
Yeah.
We'll get Ben to do some jaw thrust and airway management, just because he's snoring.
Perfect, yeah.
And then once we've got some oxygenation, we'll go from there.
A seizure is a sudden uncontrolled electrical disturbance in the brain. Sufferers risk choking and suffocating, so Tom wants to get Lionel onto the floor where it's easier to treat him.
We'll stop the suctioning at the moment. We can turn that off. So known stroke, is it? Or
No, so he's got a brain tumour. Waiting to know if it's cancerous or not, only just diagnosed.
Okay, all right, we'll just
Shall we put this off for a second, yeah?
Yeah, right there. And let's get him on the floor. Just so we can...
Ready? 3,
okay,
2, 1.
There we go. Brilliant. So then Ben's going to do jaw thrust.
Once on the floor, Ben manually manoeuvres Lionel's jaw to ease his breathing and better manage his airway.
Can you pop the pads on him? SATS probe, blood pressure, that's all we need for now, all right? So airway-wise, Ben, how are you feeling with that?
With the jaw thrust at the moment.
Sounds better like that?
Yeah.
OK, so might have some kind of brain tumour. And how was he prior to the fit? Was he all right? Or?
GPS 4, he had his eyes open, but he was completely unresponsive.
A seizure that lasts longer than 5 minutes is a medical emergency. Lionel is no longer fitting, but he's still unresponsive. They need to get him to hospital fast.
If he starts getting agitated, instead of diazepam, we'll go down the midazolam and ketamine route to manage his airway. And then in the meantime, we'll look to extricate him.
Is he doing anything?
Not really.
No, so we're
Eye
just...
is definitely permanently to the left now.
This is another indication that he may have suffered a severe brain injury.
Good man, nice and still. You're doing absolutely great, OK?
Katie and Richard decide the best course of action is to get him to a specialist trauma unit fast. They'll travel with him to provide critical care en route.
So should we just make sure he's secure at the moment? He's not got any belts on.
So, very tacky.
He's quite tachycardic, and I haven't got a good radial.
Tachy, or tachycardic, means a fast heart rate. Combined with a weak pulse, it's a sign that Jatin could be bleeding internally and is in danger of going into cardiac arrest.
I can't feel a good radial at the moment.
So should we
give some 250 mils of fluid, please?
Running open for 250, mate.
Dr. Katie gives him fluids intravenously to try and increase his blood pressure.
Yeah, 98, can you please pass a pre-alert to the QE with an ETA of about 4 minutes, please?
Dr. Katie updates the hospital trauma team on Jatin's condition.
We've got a 30-year-old male, RTC, pedestrian versus car. He's got a head injury, query pelvis, fractured right femur and lower limb fractures.
On the way to hospital, Richard carefully monitors his condition.
Looking at his chest, to be honest, Katie, from here, it doesn't look symmetrical.
OK.
Richard is concerned he may have a collapsed lung. Dr. Katie needs to decide if Jatin needs surgical intervention before they get to hospital.
I've got air entry on both sides, and chest is moving. How many minutes are we at? I don't think we'll intervene at this moment.
Finally, the team arrive at the Queen Elizabeth Hospital in Birmingham.
Are you happy, Rich?
Yeah, just his arm this side, guys. If someone can grab him. Yeah.
As every second counts, Jatin is taken straight to the waiting trauma team.
I'll grab the monitor off you. This is potentially life-threatening. He was clearly bleeding from somewhere, whether that is into his tummy or pelvis, and we won't know until the patient's had a CT and has gone to surgery here at the QE. So I think he's critical at the moment.
Air ambulance doctors come from many different medical backgrounds. Dr. Richard Fawcett is a reserve officer in the Royal Army Medical Corps. He did 3 tours of duty in Afghanistan and has flown with the air ambulance for the past 10 years.
Being associated with the military gives me a much wider exposure to a much higher incidence of trauma than you see in the UK. And that combined with the regular training courses just to keep our skills current. So when the time comes to do a procedure that might not be that common, and hopefully it's not too much of a big deal, and we crack on and do the work.
Ambulance service is the patient
hello, can
breathing?
I have an ambulance, please?
Yes,
no, she's not breathing. She's not responding.
breathing.
Can you please come quickly because she's gone in and out of seizures.
Okay.
She's only 3 years old. Please, love. Please,
Okay,
she's
all
not
right.
responding. Just come now,
Yes.
please.
An ambulance has been dispatched, but with reports of a child not breathing, Dr. Richard Fawcett and critical care paramedic Stephen Mitchell are also scrambled.
2-3, we are in the air heading towards sea and ETA approximately 12 minutes over.
They're heading to a rural location near the Welsh border, about 50 miles from Birmingham.
We've been called to reports of a 3-year-old female who sounds like she might have been fitting, it sounds like she stopped breathing. So potentially this is a respiratory arrest for a 3-year-old.
Attempting to resuscitate a child is every medic's worst nightmare. It's also much more complicated.
With an adult, everything's the same. The dose of drugs, the energy, the shock patient, all fairly standard. Whereas the size of the child, their anatomy, physiology is all different. Because she's a child, all we need to do is work out specific age and weight calculations for resuscitation. For us, it's much better to try and do this before we get to see it. We'll just prepare for the worst.
We'll take him off yours, load onto the stretcher, then pop him back on ours.
Deep in the Shropshire countryside, 51-year-old Steve is having a heart attack. Critical care paramedic Mike Andrews and Dr. Jake Turner are preparing to fly him to hospital.
Vomited once.
Vomited once, but you've given on dancers, right? Yeah. Do you reckon you can wriggle yourself up here? Just take it nice and steady. I don't want you to do anything record-breaking. Just mind your head on there.
Steve has a painful blockage in an artery that feeds blood to his heart. The drugs he's been given to ease that pain are starting to wear off.
Oh, well done. OK, are we lined up currently? Ready? Take a bit of weight.
The more pain relief is coming.
How's your pain now compared to how it was?
It's not as bad.
Not as bad?
No, it's not much better, but it's not as bad.
OK.
Right, my friend, I'm going to give you some more pain relief. Where's that grip? It's there. Can we have this arm out? We'll have that arm on your chest.
Yeah, no problem.
Thank you.
Okay.
Okay, here's some morphine. Well done.
Morphine is an effective painkiller, but it's not risk-free. It can cause breathing difficulties and vomiting, so Dr. Jake will need to monitor Steve carefully.
So here's some headphones. We're going to plug you in just a second. So here they are now. Okay, it's just to protect your ears.
I know you're not going to be sick, but I'm going to pop that thing in your hand.
Okay, mate.
Just in case. Periodically, you'll feel this cuff get tight on your arm. It's meant to do that, all right?
Is everyone happy? Okay. How's your pain on a scale of 1 to 10? Now, if you feel sick, turn your head to the side and use that bag, mate. Oh, you can do that, don't worry.
By road, it could take nearly an hour and a half, but by helicopter, they'll be at the hospital in 15 minutes. En route, Dr. Jake updates Steve's notes on the system. At the Royal Stoke University Hospital, he checks on Steve's pain levels again.
The morphine is still on offer, yeah. Right, morphine coming now.
Okay, thank you.
Before handing him over to the waiting cardiology team.
2 ECGs there. Lateral limb leads mostly. Typical changes in inferior limbs and chest, that's good. Pain's 3 out of 10 at the moment, and he's had 20 milligrams of morphine.
The first job for the medical team will be to pinpoint the occlusion or blockage that's responsible for Steve's pain.
They're going to do an angiogram, which is a X-ray dye test to look at the blood vessels to the heart. And if they identify an occlusion, they'll remove that. I'd expect Stephen to make a full recovery. He was pretty stable when we arrived, and he should do really well.
Element 03 making approach now. Looks like police are on scene.
Over Shropshire, Dr. Richard Fawcett and critical care paramedic Stephen Mitchell are arriving at the location of a 3-year-old girl, reported as having a seizure and struggling to breathe.
Are you Mum, are you? Oh, hi, I'm Richard. I'm one of the air ambulance doctors. Hello. Who's this?
What's your name?
Hey, you gonna talk to
She's
me?
not speaking properly. Like when she's speaking, it's not.
Okay, but she's spoken to you since she had a fit?
Yeah, Laura,
Okay.
you guys open.
Fortunately, 3-year-old Noreen is not in cardiac arrest. She was with her father when she started to have a fit. Her mother, Nora, was the one who called 999.
I'll tell you what we'll do, if it's all right with you. We'll just have a quick look at her and we'll get some observations on her.
Not long ago, about 2 weeks ago, 3 weeks ago. But
Okay, so
because of a high temperature.
Okay.
But she hasn't got a high temperature now.
Nora tells Richard that this has happened before.
I think she could have a urine infection because she
Okay.
keeps weeing herself and she can't hold it in.
All right.
She's saying that her belly's hurting.
Okay, I mean, that is quite common in kids. You know, sometimes they have what's called a febrile convulsion, where if they get a bit of an infection and stuff, they do have what these called, like, these temperature fits.
Febrile convulsions can cause a child to foam at the mouth, their arms and legs to twitch, and have difficulty breathing. It's frightening for parents to see, but normally not life-threatening.
Did you see it happen?
She was with her dad, and then
Okay.
me and I ran out, and then I got her and put her on the floor.
And then it lasted, how, about 10, 15 seconds?
No, it lasted about 2 minutes.
Oh, okay. And then it just stopped by itself?
When she stopped shaking, her teeth were still locking.
Okay.
And her tongue was rolling.
Okay, 36.0.
She ain't got.
Yeah. Let's pop this on your finger, shall we?
As Noreen's temperature is now normal, Dr. Richard can't be certain her convulsions were brought on by a fever. He needs to check for other causes. The fact that she recently had a similar fit is a cause for concern.
And was it like the whole body shaking?
Yeah, John Boy. Was her whole body shaking?
was in the car, sitting in the car, sitting on my lap. So all of a sudden she starts shaking and making a so
okay.
I got her out and I had my hands.
You've done the right thing there, really well done. Noreen, can I take a little prick of blood out of your finger? Is that okay?
Stephen needs to rule out low blood sugar as a possible cause of Noreen's fit.
You're going to be a big, brave girl. Little sharp prick. Well done. Sorry, sweetie pie.
She's a brave girl.
4.4 on the finger.
But Noreen's blood sugars are normal.
Because obviously she's doing a lot better now. We don't need to fly her in the helicopter or anything like that, which is good news. We'll get the ambulance crew and stuff. We'll get her on there and get her up to the hospital, and then they can dip a wee and do a few more tests and stuff like that. You got everything from like epilepsy to non-febrile convulsions and stuff. So there's a whole host of things. Some stuff is you don't need to worry about, just grow out of it, no problems at all. Sometimes, you know, it needs a bit of follow-up, maybe a bit of medication.
The ambulance crew have now arrived and can take Noreen to hospital for tests.
Are you happy to carry her to the ambulance?
We think she might have a bit of a urine infection. I mean, she does feel hot. Hey, yeah, look at that, she's smiling.
So we're looking at possible urine infection?
Potentially, from the symptoms.
Dr. Richard updates the ambulance crew on Noreen's condition.
BM is 4.8, but recovered fairly quickly. No kind of resuscitation done, although they said that she had a respiratory arrest on the phone. Normally fit and well, no allergies, no past medical history apart from this kind of episode 2 weeks ago, but no problems since.
Noreen will be taken to the Princess Royal Hospital in Telford.
If that was my 3-year-old, I'd be sort of pretty distraught and upset as well. You know, it's really frightening to watch. I think she'll probably get followed up to find out why she's keep having these fits. Maybe it's a period of observation today with a few blood tests and a couple other tests. But hopefully I wouldn't be surprised if she's at home later today or tomorrow.
It's the start of a 12-hour day shift for critical care paramedics Mike Andrews and Ryan Ferris.
How are you?
Tired. He's just getting worse, mate.
Mike's recently got a new puppy, and he's demanding quite a lot of attention.
10-month-old Doberman, so he's massive, but he's still a puppy. Slept on my bed last night. I swore I'd never do that. My youngest son wanted one, and I held out for about 2 years and then had one. And he's got no interest whatsoever in it. So he just burned me off with the craziest dog ever.
I used to have a goldfish years ago when I lived at home, Bubbles.
Bubbles?
Bubbles died, and it probably took me as a 7-year-old about 3 months to get over the loss of Bubbles, to the point like I was a bit distraught. So the idea of then asking for a dog to my parents was like, no. We just watched chaos after Bubbles died, so you're not getting a dog.
Dogs are on, bags checked.
Ambulance services, the patient breathing. Hello, it's police here. I'm just checking that you're en route to an RTC we've got coming in A5. Is the patient breathing and conscious? Not sure. She said that she saw the cyclist flying through the air. Okay, so police are on scene, yeah? Yeah.
An ambulance is already on its way, but with concerns that the cyclist may not be breathing, Ryan and Mike are also dispatched. En route, they receive an update from control.
There's police officers on scene doing CPR. So we'll take it as read as the patient is in cardiac arrest. We just don't have any more details at the moment.
During a cardiac arrest, the heart stops beating, depriving vital organs of oxygen. At the moment, CPR is keeping the blood circulating, but Ryan and Mike's enhanced life-saving skills will be needed.
Right. 2 police officers on scene. Fell off push bike, so it's a trauma. Started breathing again.
patient's still unconscious but bleeding from the face. This guy potentially stopped breathing after suffering a head injury, but has subsequently started breathing for himself. Cruising attendants by the look of it.
A further update confirms that the ambulance crew is now on scene and treating the patient, who has started breathing for themselves.
GCS looks like he's improving, so his conscious level's improving slightly, which is good news.
While still travelling on blue lights and sirens, the traffic on the M5 suddenly starts to slow.
Somebody on the hard shoulder.
En route to one emergency, Mike and Ryan come across another crash that's only just happened.
We might have to stop here, mate. I'm going to give them the heads up.
Lionel, you okay?
Although he's barely conscious, Lionel's vital signs are good, and he's breathing for himself. So Tom decides to move him downstairs to the ambulance.
So what we'll do, roll to one side, stick it under, roll to the other side. Happy with that?
First, they need to get him onto a scoop stretcher.
Obviously we're looking okay. So guys, what I'll get you to do is just roll him slightly towards you, if that's okay.
Lionel, can you hear me?
So he's oxygenating and ventilating okay, isn't he? Just don't want to make him vomit, that's the only thing. I think we'll just leave it as that, to be honest. Yes, that's fine, he's oxygenated. Okay, on three. 1, 2, 3. Well done.
Can you hear me, Lionel?
So when we're ready, just lift it a few bits and then we'll...
Yeah, ready, steady, lift.
Getting Lionel down the narrow staircase isn't going to be easy.
Can you hear us, Lionel?
Yeah, he seems to be coming around a bit, doesn't he? Yeah, he's still got this upward gaze. From an airway point of view, we'll see what sats we've got. We've got a nice heart rate of 94, blood pressure 146 M6, and we've got good radials with that as well, just check so that's coupled. So I'd say sats of 98%, self-ventilating. He's got a respiratory rate of 13. I think he might potentially have another fit.
Yeah.
If he does, we'll see if it self-terminates. If it doesn't, then we'll give him some medication to do that. When we're good to move, detach all the monitoring and just take him down.
Lionel, can you squeeze my hand? Squeeze my hand, Lionel.
Unable to respond, Lionel is barely conscious and needs urgent treatment in hospital.
On three. 1, 2, 3.
I've got the weight.
I think we're all right. We're just coming down like we're just resting on the stairs. I've got it. Yeah, just let go.
You all right there, Ben?
Yeah, good. I've got the weight.
With the scoop inside a carry sheet, they carefully negotiate the narrow staircase.
Well done. Look at that. So it's self-ventilating still. Still got no pain.
Yeah. Still ready?
Can we lower the stretcher?
Should his feet first? This way. Okay, we'll let you come round.
Hey. 1, 2, 3.
Hey, Lionel. Hello, he's blinking a bit. He's pinked up a bit, isn't he?
You all right?
Do you want to just come and quickly hold his hand? So he's had a fit. And he's quite unresponsive.
As the ambulance crew take care of Lionel, Tom wants to see if he'll respond to his partner Yvonne.
So he's just coming around a little bit now. He's just starting to blink a bit better.
Hello, darling. You're going to be all right. You're going to be fine. Don't worry. Everyone's been waiting.
There's still no response.
Okay, we're just going to get him in the back now, okay. 79-year-old male. He's had a tonic-clonic seizure lasting for a couple of minutes. He's now remained as a GCS 3.
Before they leave, Tom updates control on Lionel's condition.
Our current plan is we're not going to really do any more interventions. He's got no airway compromise at the moment. BM and temperature normal.
It's a 10-minute journey to the Queen Elizabeth Hospital. Tom will travel with Lionel on the ambulance to continue critical care.
That's dropping.
Yeah, because he's not shifting enough there. So he dropped into his chest a bit. He's got good radius.
Right lower opening the floor.
Yeah. Just feel his jaw.
The oxygen levels in Lionel's blood are dropping, and he's fallen deeper into unconsciousness. En route, oxygen is pushed into his lungs to try to compensate.
Eyes are rolled up and back.
Go on then. Off to.
An hour after his partner made the 999 call, Lionel arrives at hospital, where he's handed over to the waiting medical team.
What we try and prioritise is to make sure he gets adequate oxygenation and his lungs are working effectively, so he will need to go to sleep, be anaesthetised. From where on, they'll be able to find out what has caused the patient to go unconscious.
On the M5 to the west of Birmingham, critical care paramedics Mike Andrews and Ryan Ferris are first on scene at a motorway crash that's only just happened.
2-car RTC, 3 patients.
As they had been on their way to a different emergency, Mike updates control.
Roger, mate, from what I can see from the windscreen is one van on the hard shoulder with damage to the rear, a blue saloon across lanes 1 and 2, 3 patients all up and about conscious, 1 female patient pointing to her chest at the moment, other 2 look uninjured.
If a crew come across someone who needs medical help, they have a duty to stop. So Mike and Ryan get reassigned to this RTC.
Hello, my name's Ryan. So there is an ambulance on its way.
70-year-old Denise and her husband Robin swerved to avoid a queue of traffic on the exit slip road and ended up hitting the back of a van.
Hiya, how are we doing, folks? So what do you remember about the crash, Denise?
We're coming down here.
Yeah.
And there was queues to go off.
Yeah.
And we didn't stop quick enough.
Okay, so you crashed into the back of this young man's van. Okay. Guesstimate how fast you were going, roughly?
It must have been about 40 miles an hour off.
Okay.
You can see from where the damage is. He's on the left and we're trying to move onto the right.
Yeah.
Just everything stopped.
The passenger side of the car where Denise was sitting took the full force of the impact. The driver of the transit van has escaped uninjured.
Any pains or anything anywhere at the moment?
Down the sternum.
Pains in your chest, okay. Any other pains at all in your neck or anything like that? No? Just give a quick squeeze of your neck. You tell me if you've got any pains at all. A bit tender around there? Yeah, okay, all right. Tender anywhere else?
No.
No. So you had your seatbelt on at the time? Okay. So all that pains in your chest? Yeah. Just going to take your pulse.
Being restrained by a seatbelt, even in a 40 miles per hour crash, exerts a huge force on the body. Whiplash, bruising, and even broken bones are possible.
Medical history-wise, what do you suffer with normally?
I take the Tavastin.
Okay, so for high cholesterol, yeah?
And Lanzarote tablets for reflux. But other than that...
Okay, lansoprazole for reflux, okay. Lanzarote, I'd love to be in Lanzarote. It's almost as good as Lanzarote, isn't it?
Although Denise seems okay, Mike needs to be sure her chest pain isn't a symptom of something more serious.
Okay. Take a nice deep breath for me. In and out, and that's where it's painful.
Yeah.
Yeah, I'm just going to feel across your chest to say. Just going to have a quick look. Just look it. I think chances are it's from the seat. Okay. All right, sweet. Okay.
I'm sorry.
That pain? No, it's okay.
That hurts.
Painful, really painful there. Okay. Any pain in your shoulders at all? No.
It's tender.
Okay.
Just there.
Mike is trying to rule out any possibility of internal bleeding or underlying heart problems.
Take a deep breath for me now. And out. And in. And out. Lovely. Beautiful. So what sort of pain does that feel like in your chest? Sharp pain. Okay. Probably won't hear much, but nice deep breath for me. Good. Lovely. Well done. Okie doke.
Mike also checks to make sure Denise's lungs are clear and she's breathing normally.
Do you think I've sort of damaged the sternum, or is it just not?
Generally, the seatbelts cause a bit of bruising to your sort of layers of tissue across your chest, really. At times, we can get a couple of fractures in there. That's probably not happened for you, but that's why we'd recommend going into A&E just to see.
Yeah.
Okay.
Only an X-ray in hospital will be able to rule out any fractures to Denise's ribs or sternum.
Where were you going?
Home.
Oh.
We've been up to Yorkshire.
Oh, you're joking? You've had a long old journey then?
So we just come back, no trouble at all, no traffic. Fabulous.
Oh. And then this happens when you're nearly home.
Denise and Robin have had a lucky escape. The same can't be said of their car.
What are they going to do with the car? Are they going to take it?
Police will tow it away for you. Yeah, I think chances are that's the end of that vehicle, to be fair. But at least you're in one piece, that's the main thing, isn't it?
The ambulance crew's here now, Denise. With some assistance, do you think you can walk across, or do you want a chair? Do you want me to take your bag for you? It's not my colour. Oh, no, no, no.
Mike and Ryan need to get Denise onto the back of the waiting ambulance.
All right, Chick, let's get you up. Come on, then. I haven't used Chick in a while.
It's a 15-minute drive by ambulance to Sandwell General Hospital.
Denise, all the best, sweetheart. It's all right. You look after yourself.
Which leaves Mike and Ryan available for their next emergency call.